Hi everyone. Welcome to Cranberry. Today we're discussing the really important topic of Meftal's pass and what is up with the new government advisory which has come out. We have Dr. Liston with us today, who's a part of the Cranberry expert panel. Welcome, Doctor.
Hi,
I would.
Aditi. It's wonderful being
You
here.
too. Yeah, great. Would you like first introduce yourself
Sure,
to our
sure.
audience?
So, I'm Dr. Poongareli Liston. I'm an obstetrician and gynecologist and an infertility specialist based out of Bangalore. So, I've been practicing for the last 8 years, OBG, and my total experience would be around 11 years. So, that's shortly about me. Yeah.
Doctor, I've been taking Meftal's fast since years.
Right.
With caution, but still taking it. So, wanted to know from you that do I need to stop taking Meftal's fast immediately?
Right. So all of us, like everyone post puberty, I think every woman some point of time we have taken a Meftal spas. So the short answer would be no, you don't have to immediately stop, but you need to know what the drug is and how it is going to affect you. You also need to know what is the side effects that can occur. So Meftal spas is a combination drug. It has mefenamic and it also has dicyclomine. So mefenamic acid is an NSAID, and this is the drug against which the recent drug alert has been issued, right? So NSAID is a non-steroidal anti-inflammatory drug. So it helps by reducing inflammatory substances that are produced in our body. So this helps with controlling fever and pain. So this is the uses of mefenamic acid. So since it's a painkiller, it's very commonly used to manage menstrual cramp. Other things that it can be used is for general muscular pain, rheumatoid arthritis, lower abdominal pains. It can be used, right?
Mhm.
So now the issue has arisen after so many years of safely using it. The issue has arisen that the Indian Pharmacopoeia Commission, or the IPC, has released a drug alert. So what we need to understand is the drug alert is against the misuse of the drug. That is, when you're using the drug with a prescription, with the on the advice of your doctor, for with at a minimal dose for a minimal period of time, you should be safe, right? Unless you are allergic to the drug previously, or you do have some other systemic disorders where it is completely contraindicated. But that is a whole other topic on its own. So you don't have to immediately stop, but if you're taking it without a prescription of the drug, get in touch with your physician or a gynec so that they can advise you better on that.
Okay. How did the warning come out suddenly after years on the market?
Right. Right. So we are seeing a rise in over the counter drugs, right? So the OTC drug is a problem. So if you're taking mefenamic acid in a very low dose for a very minimal period of time, it is very pretty safe, right? It does have, it's a painkiller. So of course it is going to have some amount of side effects, which are known side effects. Like it can
Mhm.
cause, gastric symptoms like nausea, gastritis. It can, in some people, can cause allergic reactions. It can cause hypertension. These are known side effects. So is the DRESS syndrome that which has been addressed in the drug alert. So that is drug reaction, eosinophilia, and systemic symptoms. So this is a very severe and very, very rare side effects of mefenamic acid. This is a known thing, but why this has become a concern or rise in such a drug reaction is seen is because of the misuse or over the counter. So instead of taking one pill per day or up to two to three pills per day, people are taking it indiscriminately. So if higher the drug intake, higher your side effect profile is going to be. So that is
Mhm.
the reason why the alert is issued, so that people who are taking it and the doctors who are prescribing it are aware that this is a possibility and you need to look out for certain side effects.
Okay, that's very clear. Thanks so much for clarifying. So, but are they also saying that I should never take Meftal fast now for I'm gonna get my period soon? So,
Right. So no, that's not the advisory that they are giving. It is not that you should stop taking the pill or the pill is being banned, nothing of that sort. So they are saying take it with caution. And be aware of the side effects. So for that matter, any drug you're taking, be it a simple antibiotic, a paracetamol you take, or a vitamin, a multivitamin that you take, you should be aware of what the drug can do to you. Right. So that is what the commission is telling us. Be aware that there is a severe side effect that can happen. So know the need for the drug. Find out any alternatives that you can do. If there is some other way you can manage your period pain, that is something you can discuss with your doctor. Is there any underlying cause for the pain that you're experiencing? Then treating the underlying condition is the solution. So your painkillers or intake of anti-inflammatory painkillers should be the last resort, and to the minimum.
I mean, you would recommend ideally then I should go to the gynecologist if I'm
Yes.
having pain, which is menstrual cramps which are so severe, and then the doctor will decide and prescribe. Okay. And so
Yes.
usually there must be a safe upper limit and how, like,
Right. Right. So what the discussion with your doctor will go like is, you will be judged whether you are suitable for taking a painkiller. One thing, because there are other contraindication like systemic diseases, like it can be a simple hypertensive. If you have a cardiac issue, if you're already having some kidney issues, you're not supposed to be taking painkillers because these organs get affected. Second, your doctor is going to tell you about the required dosage, right? And how long you take it, so you do not go over that. So maximum you can take up to 4 grams, but that 4 grams might not be suitable for everyone. So dosage what we give for cramps would be like 250 mg mefenamic acid at least 2 to 3 times a day. That's the maximum you need to take. And if you're taking it for cramps, you don't have to take it continuously throughout. It can be taken cyclically and maybe for 1 or 2 days at the beginning of your period. So that's the minimum dose you can start. Maximum up to 4 grams. Very, very rarely you'll be requiring so much for period cramps.
Yeah, so that's around like 250 tablets
Into
in the
8
first 2
times
days
you
of
can
the
take.
cycle.
For us,
Yeah.
yeah, around.
Great. So is there like, should I be thinking of switching to some other painkiller? Is Meftal Spas particularly dangerous or?
So the advisory is against mefenamic acid and not meftalspas, but since meftalspas is very, very synonymous with the painkiller mefenamic acid, so the name has been mentioned. I'm thinking that's the reason, right? So mefenamic acid or NSAIDs or any painkiller for that matter has to be taken with caution. There is no other way. So though only meftalspas has been mentioned in the advisory, the caution is against all NSAIDs. So that is where no, that's the takeaway for us from the advisory. So yes, so all of them need to be taken carefully. Yeah.
Okay. And just a clarification. So, paracetamol or
Yeah.
Dolo is not a NSAID.
No, it is not an NSAID. It is acetaminophen. It is also an antipyretic and anti-inflammatory, but a different group which acts differently. Yeah. So you don't have to worry. So that is one thing. They do say that paracetamol might work, but I don't think patients are very happy with the pain relief that paracetamol gives, for at least for dysmenorrhea.
Especially. Okay.
Yes, that's right.
Okay. And so final question we had was also that around the long run side effects, because sometimes in the media it is vaguely
Right,
mentioned that it can damage
right,
your liver, kidney.
right,
So
right,
is there,
right.
what is the evidence and consensus
Yeah,
on
right.
that?
So these are known side effects, right? It can affect your liver, it can affect your kidney, it can affect any major organ system, but it is a very dose dependent, what you call toxicity, right? So if your dosage is very high for a very prolonged time, it is going to affect your liver and kidney, mainly because it is getting processed in both the places. So the liver is where it gets digested first and then gets released into the body, and it gets excreted through the kidney. So putting too much of stress on both the organs is going to cause side effects. So that is why prolonged use and very high dose use have toxicity on the liver and kidney. So and that is another reason why it is avoided in such patients who have complaints with their kidney and liver. We usually don't recommend such a painkiller for them. Yeah.
That's very interesting. Okay, so for now, our audience who have no time and are very busy, which are most
Right.
women,
Right.
could we do like a rapid fire version of this?
Sure.
Uh, yes, so doctor, I've been taking Meftal spa since a while, so I wanted to know, should I stop taking it immediately?
No, you don't. Be aware of the side effects. Talk to your doctor whether it is going to help you or not, and be on the most minimum dose and for the minimum time period. That would be the best.
Okay, so the government warning is not saying I should never take Meftal spas, and what is this minimum level?
Right. The government warning is not to discourage you from taking the Meftal spas when needed. So, on advice, under supervision from your doctor, you can safely take it. If you're having any adverse effects, do get back to your doctors. They will let you know what to be done. With you, you should stop. Either you should switch over. Is there something else you need to do at that point? Right. So, it is not to discourage anyone from use.
Okay, and then finally, why has the government suddenly taken out this warning?
Right, because there is a increase in side effect profile due to misuse and indiscriminate use. So when you are in pain, don't go to a pharmacy and take painkillers over the counter. That is going to cause lot of issues when you don't know the right dosage and the right duration. So this is the reason, one of the reason why the advisory has been taken out.
So not to stop the pills, but also not to ignore your period pain. I
Yes,
love.
yes.
Great. Okay. Thanks for the message.
Sure, Ati. It was a pleasure talking to you.